Hi everyone, and welcome to the latest Social Work Action Network podcast. My name is Michael Lavalette from Swan, UK, and today I'm going to be talking to Lee Humber. Now, Lee has recently published this book here, Vital Signs, which is subtitled The Deadly Cost of Health Inequalities. And Lee is going to help us understand some of the ecological, epidemiological, ideological and political crisis that we face at the present time, and some of the impacts that this might have for health and social care workers. Lee, thanks very much for coming along today. As I say, you've obviously written the book, but more recently you had an article in the magazine Socialist Review, and that 4 aspects, when you were talking about COVID, you talked about there being 4 aspects to that, and I'd like to come back and explore that in some detail. But I realise that today we're going to come across some words and language that maybe for social workers and social care workers are not part of our everyday discourse. So I thought, first of all, we might just look at some definitions so that we can understand some of the things that you'll talk about later on. So the first couple is, when we talk about diseases, we quite often hear people talk about endemic diseases, and then epidemics, and then pandemics. So can you just start off by telling us the difference between these 3?
It's fairly straightforward, really. The key is to focus on the root of that word, those words, which is demic, which means, roughly speaking, means of a population. So if you put those 3 first bits in front of it, epi, pan and endemic, then all of those things refer to something happening in a population. So in terms of epidemic and pandemic, that's about diseases affecting populations. Pandemic means global populations. Epidemic means local populations. Okay. In terms of endemic, endemic is very similar to that, in that it's again about diseases and conditions, but endemic is about conditions that are experienced broadly across populations and are potentially passed across in a sort of crowd sharing way, much in the way that COVID is beginning to become endemic in populations in the UK. So very similar, and it really is kind of, if you like, it's sort of the difference is almost in terms of quantity, really, especially with epidemic and pandemic. It's just pandemics are broadly speaking, epidemics right across the world, really.
Okay, thanks for that. Now, there's another term that started to appear, which when people talk about the ecological crisis or the metabolic rift, and that's a term called zoonosis. So what on earth is zoonosis?
Zoonosis has been around for a long, long time, actually. All it means, it's really simple. All it means is diseases that pass across to human beings from animals. And this is very, very common. You know, you think of most diseases. I just recently if you type in into Google zoonotic diseases from animals, you get about a 5-page list of diseases that have passed across. So tuberculosis, for example, is passed across from bovine, so it's from cattle. Flu, we know flu passes across from fowl, from chickens and other fowl. Measles we got from dogs. Lyme disease we get from so it's all it means is diseases that pass across from animals to humans. I suppose the current sort of thing about zoonosis is that it appears to be a new thing because of the way that COVID-19 has been explained. So it's almost like, oh, this is a new phenomenon. Some bats in China have passed this coronavirus across to human beings, and that's a new phenomenon. It's not at all. This zoonosis process has gone on right through history, pretty much since the agricultural revolution 10,000 years ago. Really, we started catching stuff from animals that we bred right from the word go.
Okay, so we've now got some definitions in place. We can now move forward with our discussion. And as I said, Lee, in that article that I mentioned earlier on, you talked about the present crisis. The COVID crisis has been shaped by 4 interlinked themes. And maybe we could take those in turn. So your 4 themes were the ecological crisis, the epidemiological crisis, the ideological crisis, and the political crisis, giving us, if you like, the perfect storm that we face just now. So let's go through each in turn. What do you mean by the ecological crisis and its impact for where we are today?
Well, the ecological crisis is the climate crisis, the climate disaster that we're living through at the minute, really. Now, I think the key to understand the relevance of this is to understand that health itself, our health, human health, throughout history, has always been contextualized by the environments that we live in, not just the ecological environment, but social environments and the natural environments. So if you start from that point of view, that our health is about our relationship with those 3 environments, then the ecological crisis starts to make sense. Because if you've got surrounding our health and surrounding the contexts that guide our health, if you've got an ecological crisis, that means that our relationship with that ecology is out of balance. It means that our health is going to be unstable and out of balance. And so, when people talk about the ecological crisis, they talk about, maybe we'll talk about it later, Michael, I don't know, but they do talk about the metabolic rift and what Marx described as this fissure, this rupture between humans' relationship with the rest of nature and the consequences of that. Fantastically far-sighted understanding of how human beings fit into that natural ecological environment. If you can start thinking about our health in those terms, then the fact that our health, global population health, is at this particular point in history on all sorts of levels starting to fail, then you can understand how that you can understand our failing health as itself an expression of our poor relationship with that ecological context. You see what I'm saying?
Yeah.
So it's both a consequence and the signifier of the fact that there is an ecological crisis surrounding our health environments.
So you mentioned Marx's discussion of the metabolic rift. So Marx is really saying that with the development of capitalism, is that right? So he's locating that in the development of capitalism in the way that rapid economic growth under capitalism and economic growth based on the profit motive uses nature, but doesn't put resources back in, and that causes that disruption. Is that right?
What Marx argues, not perfectly, but previous to industrial capitalism, there was, roughly speaking, a balance between our use as a human species of natural resources and nature, so that both of that relationship was renewable and renewed itself. What Marx says is, as soon as you get industrial capitalism, you get an exploitative society, you get an exploitative process, and that's exploitative on all levels. Capitalism, we know, exploits us. It takes away our labour and uses that as its profit. But also at the same time, what capitalism does is exploit the natural resources on every level, at a kind of, if you like, farming level, mining level, but then as we've just spoken about, that expresses itself at an ecological level. So as soon as you start to if you like, shrink resources in one aspect, then it has a feed-on effect at an ecological level. So yeah, absolutely, Marx located it in the development and beginnings of industrial capitalism. What he said was that marked a fissure between the human species relationship with the rest of nature, and that was degenerative. And 150 years later, it couldn't be clearer.
Yeah. And so as we continue, so at the present time, how does this help us understand the development of COVID? I mean, we talked about zoonosis earlier on, and it's always been there, but there is a sort of understanding that, that the conditions and the ecological conditions and the conditions of economic growth are perhaps creating more conditions for viruses like this to to move from species to, how does that happen? What's the processes at work here?
Yeah. Well, as we know, what industrial capitalism leaves no stone unturned. So, one of the important regions in terms of understanding infectious diseases and the spread of infectious diseases is the industrialization of farming. So farming techniques, especially since after World War II, 1944 onwards, the industrialization of the farming process has driven back the borders of nature, if you like. And so, there is good evidence to suggest that this current coronavirus arose from moving deforestation in the process of moving farming further and further into natural forests. And as we get further and further into those natural forests, what happens is you unearth things like coronavirus and other viruses and other species and all sorts of stuff that have not that human beings haven't come across before, and that sort of stuff getting through a process of zoonosis crosses the barrier and into human beings. So it's that process of industrial farming processes which have gone on at a faster and faster rate. I think I write in the article a couple of 3 months ago that China is if you like, a late arrival on the industrial farming techniques. These things were pioneered by America and Europe in the 40s and 50s and 60s. China arrived late, but having arrived, they've industrialized at a massively rapid rate, and that's just driven the natural forests right back. And as a result, in this case from China, but not always from China, we've set loose these sort of these viruses that we've not come across before, and that are not willing to cooperate with us.
Okay, so that's the first part. That's the crisis. That's the big context. You then argue that this is then linked into the epidemiological crisis. So explain to us, what do you mean here?
Epidemiological crisis, it really talks to that some of the stuff that I explore in my book, that populations, especially over the last 40 years, really during the period of neoliberalism, populations have become increasingly unequal. And so what you've got is populations that have marked differences in terms of what's called the vulnerability to disease. Now, really, I should have made this point earlier on when we were talking about definitions, because a really important definition in terms of diseases is the difference between people being susceptible to a disease and people being vulnerable to a disease. Now, we know that everybody is susceptible to the coronavirus. We know that Prince Charles maybe got a dose and Boris Johnson got a dose. Both of those recovered because they were susceptible but not vulnerable. So what we've got is an increase in sections of the population who are vulnerable to the worst effects of this coronavirus and future viruses, for that matter, and other epidemics that are going around the world currently. Now, the only way you can understand that vulnerability is by understanding health as a relationship with people's environments, not just natural environments, but social environments. This vulnerability flows from people's positions in society. So, you look at some of the higher rates of people who are the case fatality rates, people who are dying from coronavirus. These are all from vulnerable populations, older people. Lots of the rates for BAME communities are massively high, massively disproportionately high. People with underlying conditions, all of those things are contextualized by people's social standing, by their positions, their if you like, epidemiological position in populations and in societies. Does that make sense?
So that does make sense. So that's at heart is why when people talk about epidemiological crises, they're talking about inequalities and the impact that inequalities have on people's health.
Yeah, absolutely. Yeah, entirely.
Okay.
And lots of examples of that. I don't know whether we'll talk about this.
Yeah,
a bit later.
go on. No, go ahead. Yeah.
Okay. Well, so for example, a very sort of current example would be flows from the current protests and crisis in the States, in America, and that whole kind of the racist killing of George Floyd and stuff. Now, if you look at if you like, the context, obviously there's a long-term context of racism specific to America. But also, what has triggered this is that long-term racist context of America in the shorter context of what's happening around COVID and around the pandemic. So if you're black in America, then on average, you're 3 times more likely to die of the pandemic than white people. That's on average. In some areas, it's much higher. I look, for example, at the average in Kansas City. You are 7 times more likely to die if you're black in Kansas City than whites. Now, there are reasons for that, and just a tiny little piece of research, maybe 2 hours of research, I found in Kansas City. After World War II, there was a racist policy in terms of mortgages, which has meant that black people can't get houses, still struggle to get houses, and they're confined to inner cities. In the inner cities, the unemployment rates in 2 areas I looked at, unemployment rates were something like 24 and 43%. So housing is a problem. Employment is a problem. They didn't start to desegregate schools in Kansas City till 1980, so education is a problem. So you can start to build up a picture of how these social determinants of health disable people, make them, enfeeble them, make them vulnerable. And then what the pandemic has come as, really, it's the pandemic has delivered the coup de grace, really. So in America, I think I write somewhere, in America you can die instantly from the police, or over a short period of time because of the pandemic, or over a long period of time just because of racism, because it's institutionalized and in the sinews of the way American society is run.
Great, fantastic. So that leads nicely into your next aspect of your crisis, because what you're just describing there is then shaped obviously by government policies. So your ideological crisis, I suppose, is looking at the way, especially in the UK and America, the way in which welfare policies have been shaped over the last 30, 40 years. So the ideological crisis is really about the impact of neoliberalism on our lives. Is that right?
No, entirely. Yeah, entirely. Ideological and political, really. And I suppose rooted in the economics of neoliberalism and privatization. Again, I talk about, maybe just a short example might illustrate this, really, in terms of what I was talking about, vulnerable groups and things. So, as we know, one of the most vulnerable groups have been older people. So you look in either in America or in the UK, the poverty levels for older people in both of those countries are massively high. There is the Lancet magazine, which is a magazine of doctors, talks about the epidemic of malnutrition amongst older people in the UK and in America. Malnutrition obviously is going to weaken hugely people's immune systems and make them vulnerable. When you know that residential homes, there was a piece of research carried out by Sheffield University recently that showed that on average, older people in residential homes get something like £2.40 a day spent on them to feed them. £2.40 for the whole day. Now, obviously, that's going to make people, that's not nutritious. It's not going to support people's nutrition. So that makes people vulnerable. Now, what's the cause of all that? Well, we know, don't we? We know that over the past, since the late 90s, all of that kind of social care has been privatized, has been pushed out to profit-driven companies. And, so the £2.40 a day on meals for older people is so that private residential care providers can make a profit. What's behind that is the profit motive. Instead of feeding people, it feeds the pockets of investors in private home care. So it's massively ideological. That whole political, ideological drive to privatize, to increase profit at at all costs, including at the cost of the lives of people, has made people vulnerable. Again, what the coronavirus has done, what COVID-19 has done, is just expose the weaknesses in how society is being organised.
Mm. And obviously, in terms of care homes, I mean, the UK government doesn't include those all the time in their figures. And, you know, but when at the time of recording, the official government figures are just under 40,000, but everybody knows it's well into the 60s now.
Yeah.
But the COVID has clearly ran through the care system and older people's.
Funnily enough, this first came to my attention because of a good friend of mine in Liverpool actually brought to my attention that I can't remember the area it was, but a residential home in Liverpool, when it was covered in I think the Liverpool Echo. And when it first reported, 3 people in this particular residential home had already died of COVID, and then it was revealed that for the previous 2 weeks, the manager of this particular residential home had been complaining and saying we haven't got enough staff because staff were shielding at home or they were ill themselves, and that the COVID had taken grip and just ran through the whole home. And by the end of it, I think 10, 12 older people in this one home died, you know, because what you've got is vulnerable people passing this deadly disease on to other vulnerable people. It's just, you know, it's the perfect feast for a virus like coronavirus, really.
Okay, so that takes us on to the final element you talk about, which is the political crisis. And I suppose, you know, you look around the world and so, you know, at the point of recording yesterday in the UK, there was 394 deaths, and in the rest of the EU together, there was far fewer. We look at New Zealand, where the death rate has been very low. We look at South Korea, who managed this, and yet in Britain and the States, Sweden to some extent, the death rate is huge in that way. So, I mean, what are the reasons behind this? What's going on in terms of the political crisis, and how's it impacting COVID?
I think it's a question of political choice and political strategies, isn't it? Really, no, I think it's really telling that the UK in terms of Europe is, you know, has got the worst record. The United States, obviously, is we can only start to guess at how rampant and rabid the virus is going to be across the United States. But United States, and then also if you think about Latin America, and Brazil at the minute is an absolute epicenter of the disease, and again starting to rip through whole Brazilian populations. And for each of those 3, you know, we're talking about in those particular reasons, we're talking about leaders of the sort of, you know, the private healthcare and the neoliberal approach to care. You know, in the UK, for example, as I said earlier on, really since the late 90s, there's just been a switch into wholesale replacing any kind of public social care with private healthcare, such that I think public healthcare is down to something like less than 10% of the total now, and increasing that's leaking over into NHS provision. So through a series of political choices, political strategies to support and the profit-making motive of health capital, this is what we've got. It's in the UK and America that they've chosen to. Actually, this was really illustrated to me this morning. I was talking to a parent at the school where my daughter goes usually, and she was talking about the fact that we can no longer trust anything that our politicians say, because it's so obvious time and time again that they have lied. You pointed out the fact that they've the numbers in terms of care homes were underestimated and then hidden. the whole Dominic Cummings thing, and him lying about going up north, and his missus lying about going up north, and the whole the fact that Cummings is farming out various contracts to various of his health friends. It's all about and the fact that the strategy in the UK, and that slogan, I can't remember the last slogan that they used, but basically slogans that pass responsibility from central government over to individuals, and over to individual relationships with their employers. So this friend that I was talking to this morning talked about the fact that okay, so schools are being reopened, but after schools aren't being reopened. So if you've got a job that runs till 4 o'clock, if your employer says no, you can't have the extra time off to go and pick your kid up, what are you going to do? So it's in the UK, in the US, and certainly in Brazil. The politics have moved decision making to those individualized relationships, whereas in other places, Germany, you mentioned some of them, South Korea and various other places, it's been far from perfect by any means, but much more of a collective and centrally directed thing, so that there have been definite, no, we're going back on this date, you're still staying away on this particular date. Whereas in the UK at the minute, as people all know, we've got a kind of drift back scenario going on. So and all of it in the UK and America and Brazil and other places, driven not by the concerns of the health of children going back to school or children passing it on to parents or whatever, but driven by the need to get workers back to work. All of this is driven by economic considerations. Our politicians aren't worried about our health. Politicians are worried about the profits of the companies that they represent.
Lee, thanks very much. That's been incredibly enlightening. And if you've enjoyed this, then please do buy and read Lee's book, published by Pluto Press and available, as I say, at all good bookshops. Lee, thanks very much on behalf of the Social Work Action Network. Thanks for your time this evening, and good chatting.
My pleasure. Thank you.